Hello students, this is a lecture for Dental Radiography, Chapter 1. It is vital to know the basic terminology associated with radiography. Be sure to go over these terms until you feel confident that you understand each one and do not get similar sounding terms confused with each other. Radiation is the energy emanating from a source and carried by waves or streams of particles. X radiation is high-energy radiation produced by the collision of a beam of electrons with a metal target in an X-ray tube. An X-ray is a beam of energy that has the power to penetrate substances and record images and image shadows on photographic film. Radiology. The suffix ology means the science or study of something. Therefore, radiology is the science or study of radiation. In our case, it's related to the medical science that deals with the use of X-rays, radioactive substances, and other forms of radiant energy in the diagnosis and treatment of disease. A radiograph is a picture or a visible photographic record on film produced by the passage of X-rays or radiation through an object or body, also called X-ray film. In practice, a radiograph is often called an X-ray, but this is not correct. X-ray is a term that refers to a beam of energy. A dental radiograph is a photographic image produced on film by the passage of X-rays through teeth and related structures. Radiography is the art and science of making radiographs by the exposure of film to X-rays. Dental radiography is the production of radiographs of the teeth and adjacent structures by the exposure of film to X-rays. A dental radiographer is any person who positions, exposes, and processes X-ray film. This could be a dental assistant, a dental hygienist, or a dentist. In dentistry, radiographs enable the dental professional to identify many conditions that may otherwise go undetected and to see conditions that cannot be identified clinically. Many dental diseases and conditions have no clinical signs or symptoms and may go undetected without the use of dental radiographs. Dentists should weigh the benefits of dental radiographs against the risk of increasing a patient's exposure to radiation. Dental radiographs may be used to detect lesions, confirm or classify suspected disease, localize lesions or foreign objects, provide information during dental procedures, evaluate the growth and development of the bones of the head and neck, illustrate changes secondary to caries, periodontal disease, or trauma, and document the condition of a patient. See your textbook on page 3, box 1-1. In 1895, Wilhelm Conrad Roentgen was experimenting with vacuum tubes and fluorescent screens when he noticed that screens were glowing even though they were several feet away from the tube. He determined that some mysterious ray was causing his screens to glow. After replacing the fluorescent screen with photographic plates, he was able to permanently capture images. He then placed his wife's hand on a photographic plate and exposed her to the rays for 15 minutes to show that he was able to permanently capture the outline of her bones. This event was also recorded as the first radiograph of the human body. Roentgen was a humanitarian who never patented X-rays. Instead, he gifted his discovery to the scientific community. If you look at pages 4 through 6 in your textbook, much research was conducted into radiography by many scientists between 1838 and 1896, culminating in a college course which taught dental radiography. Edmund Kells in 1896 is credited with having exposed the first dental radiograph in the United States using a live patient. In 1913, William Coolidge developed the first hot cathode X-ray tube. There is a video in this course of William Coolidge explaining his invention. From 1913 forward, most research was focused on improving the machine that produced the X-rays. William Coolidge patented the use of a tungsten filament in the X-ray tube. It was also in 1913 that Eastman Kodak Company started manufacturing pre-wrapped intraoral dental film. Various radiographic techniques were developed from 1896 to 1947. Nowadays, the operator is free to decide which technique to use according to the patient and diagnostic needs. Since 1947, the focus of research has been on making dental radiography safer for the patient by increasing film speed and reducing scatter radiation. When you watch the videos, please look out for this important information. X-rays are similar to visible light but have shorter wavelengths and are therefore invisible. A cathode ray tube is a TV tube that works like an X-ray tube and emits X-rays. X-rays pass through some substances more easily than through others. Air-filled lungs block very little X-ray. The heart is dense, blocking some X-rays. Bone is even more dense and blocks more X-rays. The first improvement in the configuration of the X-ray tube was accomplished by moving the anode position directly across from the cathode and beveling the face of the anode to focus the X-ray beam in one direction. The second improvement was changing the cathode from a single basic disc to a heated tungsten element. In the final design change, the beveled anode rotated instead of remaining stationary in order to avoid burn spots on the metal. This concludes this section on dental radiography.